Hi everyone, welcome back. I'm Dr. Karri Cardinal for your health tip of the week, and today my health tip of the week is when to use ice. So I often get asked by patients whether they should ice or heat, and the number one rule for icing is you always want to ice when there's an acute injury or a flare-up of a chronic injury. So if your pain is worse than it usually is, then that is when you want to use ice. Ice is typically used for the first 24 to 48 hours. And the rule with ice is you want to ice it for 20 minutes on and then leave it off for 60 minutes. You can do this as much as you want within that 24 to 48 hour time period. But again, to go 20 minutes on and 60 minutes off. And then after that, you can definitely use some heat. Always want to use moist heat as it definitely will penetrate through the skin and get into the muscle a little bit better than dry heat. And then sometimes you can also use what's called contrast therapy, where you go 5 minutes of ice, 5 minutes of heat, 5 minutes of ice, 5 minutes of heat. And that helps to act as a pumping mechanism to help pump out that chronic inflammation. And we do that when we're past the acute stage, but we're still having maybe some minor inflammation that's not getting out of the body. And we really want to help facilitate that pumping action to get rid of that kind of more stagnant inflammation that may be going on. But again, when you are in acute flare-up or when you have a flare-up of a chronic condition, when you're in more pain than you usually are, you want to use that ice for the first 24 to 48 hours. Thank you for listening. Have a happy and healthy day. See you next week.